So we have a case of nevus, one on the left side of the forehead and one in the nasolabial area. We're going to do excision of the nevus or nevi because they're under nerve blocks. So if we do excision, there are two options. One is elliptical excision and the other is shave excision. If we do a elliptical excision, this is the midline of the mole. So this is the width of the mole. That is the border on each side. The length is 2 times the width. So the defect will be this much from here to here. That will be the length of the scar. It will be lying horizontal. That is along the longest line. That is the way to excise. Again, that is the midline, and that is the longitudinal axis, the horizontal axis. Now, this is the width. The length is 2 times the width. So that will be the length of the scar. In here, it's longer. We're going to do the procedures under nerve blocks. The nerve to block is the supraorbital nerve. So it's along the medial border of the limbus. So your entry will be here, along the thin skin. We are in the subcutaneous plane, and the needle is directed superiorly along the medial border of the limbus, going up and approaching the supraorbital rim. I'm using a 1% lidocaine with 1:200,000 epinephrine, and I'm using a gauge 30 needle on a 1 cc syringe. Now, you hug the bone. I am in the supraperiosteal plane of the supraorbital bone. Now we're going to block the infraorbital nerve, a branch to the nasolabial area. Open your eyes. That is the limbus, so your direction is enter between the ala and the nasolabial fold. The needle is directed towards the medial border of the limbus. So the entry is in between. So I'm in the deep subcutaneous plane. This is already numb, just to make sure the area is already anesthetized. Now we go back here and I'll do a subdermal. I chose to do a shave excision because of the long scar. I'm in under the dermis, subdermal. The area is already numb because we blocked the supraorbital nerve. We wait for 10 minutes just below the dermis. I'm using magnification when I'm doing this procedure so that I can see the details, or a higher magnification. Now to do the shave excision, apply soap and then traction, counter traction. I'm using a razor blade. Initially, you have to go shallow, and then as you go in the middle, you bend the blade so that you go deeper. And then when you are about to be finished, release, so you'll be shallower. Okay, counter traction, so you go a little bit away. Now, when you are under the mole, you have to go deeper, and you do a to and fro motion. You release a little bit, you go shallower, so you release. You check for the border. You can excise a little bit more if there is suspicion. So you are in the subcutaneous plane at the middle. This is hydrocolloid dressing. Using a new blade. This is shallower. The first one is big and deep, so you have to make sure that you reach the subcutaneous plane. The circumference of the wound is just above 1 centimeter diameter, so you can expect a secondary healing. Now stretch here. This one just above the lesion. We apply pressure for 10 minutes. Relax. So the subcutaneous is this much. You still have dermis remaining. So the healing will be coming from the dermis. The other lesion, that is the underneath. So we were able to remove the whole of the moles.